For Women's Health Week in May, we wanted to talk about different topics in women's health, including preventive care, annual exams, when to call the doctor, safety of care during the pandemic, and more. I'm with CU Medicine provider Dr. Whitney Jambardino, an OBGYN at CU Medicine Obstetrics and Gynecology in Highlands Ranch. Thank you for joining me.
Yeah, thanks for having me.
Of course. So many have put off doctor's visits over the last year, not just women, but everyone. But why is it important for us to keep up with our appointments and get in for our annual exam, especially if women have missed this past year?
Yeah, I think the most important thing, women think of the gynecologist as somewhere you come just if you're having a baby. But really, we are in charge of your pelvic health, your breast health, and really keeping on top of general healthcare maintenance that other doctors might not follow. And so really what we see are a lot of people putting off care that could be benefiting a lot from routine screening mammograms and Pap smears to catch precancers and cancers before they develop and become more severe. We also find a lot of women who have missed care and end up coming to us with really severe bleeding. And so those are things that we want to take care of and want to get on top of early and make sure that we're really following people closely. Just aside from birth control, we do a lot more than that. And I think it's important to keep in mind your entire GYN health, whether it's sexual health, your hormones, your transitions through life. So from having children into menopause, preteen years, all of that's important. And putting those things off definitely can result in more concerning healthcare problems down the road.
Talk a little bit about what you are seeing in the clinic, women coming in. I've heard abnormal PAPs are on the rise. Talk about what an abnormal PAP is, what that would mean.
Pap smears are confusing. We used to say, get them every year, come in, get your pelvic exam. Now we know that Pap smear guidelines have actually changed in the past couple of years. And really the focus now is understanding that there's two different types of abnormalities. So one is abnormal cells. The other part of a Pap smear is HPV, or the human papillomavirus. Both of those are important, and both of those are things that we're now testing for. So when you get your Pap smear, now we are spreading them out. If your Pap smear is normal, we really, after the age of 30, if we have normal HPV testing in cells, we're letting you go 5 years. The reason for that is that we know that human papillomavirus is the thing that causes cervical cancers and precancers. And so now that we kind of know what causes these precancers, we're able to intervene early, prevent advanced cervical disease, which is really helpful. Which is why you've seen those changes recently. So I think the most important thing for people to remember is when their doctor tells them they have a normal Pap smear, there's cells that can be normal or abnormal. And then there's also HPV that can be normal or abnormal. It's also important to realize that HPV, although it is sexually transmitted, is really, really common. So most patients who have had a sexual encounter in their life had come in contact with it and will test positive at some point in their life. And so it's important for us to make sure that we're keeping that virus in check. We're keeping a close eye on everyone's cervix. And we do that through Pap screening to look at the cells.
If someone does have a normal Pap and they're told they don't need to come back for 5 years, or at least have a Pap for 5 years, do they still need to come in every year?
That's a great question. Absolutely. And so I think that it's hard when we change these guidelines. People feel like if they don't need a Pap smear, it's not necessary to come to a gynecologist. The difference is I'm still looking at your cervix every year. I'm still making sure that it looks visually normal, that your cycles are normal, that you're not having breast concerns or other concerns. And then really importantly, we're doing a bimanual exam where we're actually feeling the uterus, feeling the ovaries, and making sure there's no pelvic masses. A lot of things sit in the pelvis, your ovaries, your uterus, things like your rectum. And so that's an area of the body that a lot of doctors aren't paying attention to during your general healthcare exam at your primary care doctor's office. They're focused on the big things like heart and lungs. We're really in charge of helping women's pelvises. And so those exams still are really pivotal to keeping you healthy. And then if there's something abnormal, we might do the Pap smear more often.
You mentioned HPV. I know it's a vaccine that we ask, you tell teens to get. Is that something you can get as an adult? Didn't guidelines change for that recently too, that you can get it at an older age?
That's a great question. So we used to go up to age 26, and most women were coming into us in their teenage years to get it, or at their pediatrician office. Now we have actually extended those guidelines to vaccinate women up to age 45. So that is something that is really helpful to protect against multiple strains of HPV. The other thing is we'll sometimes even vaccinate beyond that for really high risk or complex patients. So you are still a candidate, even if you didn't get it early on in life now, especially age 45 and under.
What puts someone more at risk? Is it just more sexual partners, what puts someone at risk for HPV?
More sexual partners definitely can increase your risk of HPV. The other things, though, that put you at risk for cervical disease, precancers and cancers are things that compromise your immune system. So patients who are smokers tend to have worse cervical disease or more likelihood that the cells will start changing because of HPV. People who have really advanced diabetes or are on immunosuppression for other diseases like rheumatoid arthritis or Crohn's. And then beyond that, people with HIV. So those are our big populations that we're thinking of. We will do Pap smears more often for those folks. And then if you have an abnormality and you are a smoker, let's say, it's something that I want to pay a lot more attention to your cervix, because we do see a lot of changes on the cervix, just like we see elsewhere in your body from smoking.
In addition to annual exams, we talked about those. When should a woman call a doctor? What sorts of things are a cause for concern?
Yeah, so for gynecologists specifically, really heavy periods that are either bothering your quality of life or are heavy, making you sick, bringing you to the emergency department, causing you to feel lightheaded or dizzy. Irregular bleeding, that's the other thing that we see a lot of, but a lot of people will put off. People saying, I haven't had a period in 6 months, but it's kind of great. That's actually concerning. And that's something that I want to make sure we're taking care of you and your uterus. So I'd want to see you for. Other common things would be things like pelvic pain, urinary tract infections can go to your gynecologist, hormone concerns, breast concerns, all of that is definitely within our wheelhouse as OBGYNs and something that we'd want to be seeing here in clinic.
How can an OBGYN help women as we age?
Yeah, so that's a great question. Like I said before, really GYN doctors and OBGYNs manage from puberty through end of life care, really. And so as we age, things that I always tell my patients is, as you're approaching menopause and the menopausal transition, that takes place over a lot of years. And a lot of different women are impacted in different ways.
But what are some concerns for women who are entering or experiencing menopause? And I've heard of premenopause. Is that really a thing? Talk a little bit about that too.
Premenopause or perimenopause is a time in life where we start seeing a transition from how the brain is telling the ovaries to ovulate, release eggs. We see a lot of abnormal bleeding develop during that time frame. So average age of menopause in this country is 51. We can see this even a decade earlier for some patients if they're going into menopause early, definitely a couple years before true menopause, which is not bleeding for over a year. So people will say, gosh, I've noticed that I'm gaining more weight or it's harder to lose weight. We see a lot of metabolism changes. We see a lot of that irregular bleeding, like I talked about, or heavier bleeding. And so those are things that we'd really want to get you in and help manage early on because it's something that's easily treatable with a gynecologist. And then as you approach menopause and you have your last period, we do start seeing a lot more things like hot flashes, night sweats, and insomnia creep up. And then things that people might not attribute to menopause, like vaginal dryness or low energy. And those are all things that we definitely want to talk about and help treat women through that process.
When you talk about treating, is it usually a medication? Do you do blood work to check hormone levels? What are treatments if someone has menopause concerns?
Yeah, so the first thing is making sure it's truly menopause. And so really that's based off of a history more than anything else. Again, a year without any periods. Sometimes we will check labs to confirm that if it's a little bit cloudy, the picture. But really, I caution most of my patients against true hormone checking your testosterone, checking your estrogen levels. The reason why is my goal as your doctor is to make you feel good again. It's not to make you feel like you're 20 or you're 13 or you're 40. It's to make you feel good. And that can be a little bit of hormone replacement, no hormone replacement. And really the levels, I think, kind of cloud that a little bit. And so more important to me than anything else is how are we making you feel? If I can make you feel better, sleep at night, not have hot flashes, we've done our job. And it doesn't matter what your estrogen level is. And so that's what I really like to clarify with my patients. It's become very popular to do things like pellets and checking hormones every week. That's really expensive. And I think it's really unnecessary for most patients and sometimes can cause harm. And so really we go off of your symptoms. Can we make you feel better?
You provide care at CU Medicine OBGYN Highlands Ranch. Talk about your approach to caring for patients.
Yeah, so my real focus is kind of evidence-based medicine, following the data, following what we see when we look at large cohorts of patients and making sure that I'm taking that data and applying it in a really patient-centered sort of way.